Avian circovirus and chicken infectious anemia, also known as CIA. So, general characteristics of circovirus are they have an ssDNA circular, which makes them DNA infective. They are non-enveloped, which makes them very resistant. And they have cellular polymerase enzyme, which means they replicate in dividing cells. They have a high morbidity and a low mortality, and they cause immunosuppression. The first disease is beak and feather disease. It occurs in Australia in parrots, specifically cockatoos. So the epidemiology. Horizontal and vertical infections occur. It's germinative. It spreads in the feces and respiratory secretions. Convalescent birds are persistent carriers, and it survives in the environment because it's non-enveloped, which means it's very resistant. The pathogenesis means the infection occurs through the oral nasal route through primary replication in the lymphoid tissue in the throat, which causes viremia. It then affects cell-bound macrophages, and then secondary replication occurs using cellular polymerase. This occurs specifically in rapidly dividing cells, such as the feather follicle and the beak and claw. This is the area for cell division. The clinical signs happen in animals younger than 3 years. In animals older than 3 years, it's still subclinical, but they can shed the virus. This disease can have acute and chronic. In the acute phase, it can cause fever, anorexia, and death in 2 to 4 weeks by secondary infection, and the signs are respiratory signs and weight loss. In the chronic form of the disease, it causes beak and feather deformities. They can have this for years or under 1 year by death by secondary infection. Chronic infection is only obvious after molting. In the pathology, we see enlarged lymph nodes. The second disease is the pigeon circovirus. It occurs worldwide. It is known as the Columbid circovirus or the pigeon circovirus, PICV or COCV. It mostly occurs in pigeons between 1 and 12 months old. Just like in parrots, it has beak, feather, and claw deformities. In young animals, the mortality can be up to 100%. It's a quick death and happens between 2 to 4 or 5 days in an acute case. Animals that survive the disease have a decreased race performance, and the virus causes spleen and thymus cells to be destroyed. The third disease is the goose circovirus. It affects goslings around 1 week old, and they have a higher mortality rate due to a co-infection with Rhimarella and Aspergillus. The virus can be detected directly through PCR, or it can be detected indirectly through ELISA. Next, we need to look at chicken infectious anemia. It occurs worldwide and only in chickens. It comes from the Anelloviridae family in the Gyrovirus genus, which causes the chicken infectious anemia virus. So for the epidemiology, it can be spread in the feces up to 2 months, and it can spread vertically and horizontally. So the pathogenesis. The infection occurs through the oral route, and the primary replication occurs in the small intestine epithelium, which causes viremia. This viremia becomes cell-bound through macrophages and dendritic cells, and then the secondary replication occurs in the thymus, bursa, and the bone marrow, which causes anemia and immunosuppression. The main target of this virus is the hemocytoblasts and the T cell precursors. After the progenitor cell, the B cells are not affected. So the clinical signs. If it's in animals under 3 weeks or 10 to 14 days, it's severe. And if it's in animals over 3 weeks old, it's subclinical. The clinical signs are anorexia, dermatitis, and most of all, paleness. In the pathology, we can see anemia and the bone marrow becomes yellow. There can also be thymus atrophy, bursa atrophy, and hemorrhages and edema. The vaccination protocol is different from hens and chicks. In hens, you give it in the drinking water, attenuated at 12 to 16 weeks. In the chicks, you give it an inactivated form of the virus, intramuscularly or subcutaneous at 2 weeks old. The differential diagnosis is infectious bursitis, except this has more hemorrhages.